Afternoon. We're here talking about the use of fat transfer to create buttocks enlargement, which is a much requested procedure these days. And there's many nuances and details about this procedure that are important in terms of understanding it and important in terms of performing it. One of the keys to our getting consistent success has been our technique of harvest, which is basically standard 2 method liposuction, but we focus on getting a very clean removal of fat, which means we're looking at a large can or collection jar of large volumes of fat. We use a larger cannula for the harvest of this particular type of fat, and are very aggressive about staying in one area for as long as it's possible to get as much fat in more complete units. We feel that when the fat starts to break down, the lipid inside tends to make it much easier to dissolve and separate from itself, and there's a much lower retention rate. Retention means when you put the fat in, it tends to always look good for the first week, and then after several weeks it really starts to change. By 3 months it can be a dramatic loss of fat if the fat is all broken up and it's harvested in a very bloody fashion. So that the technique of just simply removing the fat is extremely important, which is as atraumatic as possible and in as large of component units as possible. Then same setting in a sterile technique, we then use larger Toomey syringes, large cannulas with large infusion tubes or cannulas to put it into the tissue in the buttocks. Now the technique of placement is very important, because what we do is not just putting it into the deeper layers so that you're not going to have a problem with seeing or feeling the granules of transplanted fat, but also putting it in multiple planes in the deeper layers, which requires a lot of diligence. You're not simply just putting the cannula in the fat and injecting it wherever it is. You're taking it and placing it, separating it out in a circumscribed, in a predefined area, so that you're getting not a spreading out in the superficial planes, which could give you a possibility of feeling or seeing the lumps, but putting the volume in deeper planes so that you get a much more sort of rounding rise of the buttocks. Here we have numerous examples, but this is a typical example of somebody that had fat, and not a bad profile of a buttocks, but both a little flatter than she wanted, and certainly not high definition, and the sort of bottom portion which has kind of a longer buttocks appearance than she wanted. As part of the procedure, we took fat from her abdominal wall and her back, and from the shaping below the butt, gave us enough to give a good increase from here to here in the upper butt. And this fat is placed even in the larger person in the deeper tissue, so that the rounding up, when you feel it and see it, is almost imperceptible. You can hardly tell. Except, of course, as you start to press down, where that transplanted fat is, it will start to become hard. We also believe that the fat changes character. It's not as much like the same fat that you took out of, like a piece of chicken fat or something. It changes to sort of a more thicker, fibrous type of tissue and becomes more solid, and probably less responsive to weight gain, weight loss, which means that if you gain a bunch of weight, you're not necessarily going to make that tissue that you transplant a lot bigger. On the same token, by losing weight, it's not necessarily going to be quite as much of a drop in the volume in that tissue that's been transplanted, because now it seems to be a little more scarred down and thicker. We've had the experience of reoperating on several of these, including fat transfers to other areas, facial, breast, and have looked at the fat, and it definitely has changed and become more thick. So by clinical experience, we've seen that this is an explainable phenomenon. With any of these procedures, there's going to be a loss of some volume after 3 months, no matter who does it and how it's done. It's just part of it, and so that is important to explain to the patient prior to the procedure. Furthermore, both based on placement and then what happens to a patient after surgery, it can be a unequalness, although we have not experienced this in any significant form. There's always a possibility that one side's going to swell less or going to be higher than the other. And in the first couple months, we've also found that it's a good opportunity, because even though there may be small differences, some of those differences can be changed by simply massaging, usually by the surgeon, and manipulating, because they know the consistency and the depth of the transfer, and it's good to keep coming back to the doctor and letting him see what's happened with you. And there's still a chance to sort of mold the fat and treat it as if it still has a time to be separated out and dispersed, and so there's still a chance to sort of change the final result. Even if it's not perfect in the first couple months, you can do a lot of things that improve the shape and the texture. The healing process, though, as far as recovering from the surgery, has been very fast. People are back at desk jobs within 2 or 3 days average. The next day, patients have absolutely minimal soreness. There's always some soreness associated with both in the buttocks and wherever the fat's harvested from, like the abdomen. So it's not a pain-free surgery, but it's certainly a very modest amount of pain. Men and women are bouncing up quickly from the liposuction procedures. We have been very fortunate to have excellent anesthesiologists, all board certified, and have really worked hard to perfect the twilight type of anesthesia, where the patient is still breathing on their own and still has some reflexes, and we don't necessarily want to keep somebody in a very deep state. What we in fact like is during the surgery just enough change in the anesthesia level, not something that you're going to know after surgery, but something that we know during the surgery, that it's good to, we like to let the patient get a little lighter during anesthesia, and that means they cough, they move their legs to prevent blood clots, to prevent breathing issues, and all of the patients, with no exception, have had excellent recovery, and this has been over thousands of patients since 17 years now. There's been absolutely no problems related to anesthesia. We believe this works well for the patient, and patients, every one of them have got up and walked out after surgery with an excellent recovery and experience. So it's been very, very safe and very reassuring. We stick with the same formula for most cases. We can't guarantee that every patient won't need a deeper anesthesia, but that still is always an option with a well-trained anesthesiologist, which lets the surgeon concentrate on all the technical issues we've already discussed. The other things, as far as the recovery process, it's important both not to wear any binder or something that's too tight. It's also important not to hit your area that the fat's been transferred in, because that can break down the newly seated tissue, and you may get some tissue loss from those things. Also, of course, smoking is a big no-no, and that can cause problems with any surgery, but we would certainly have to say that's totally dangerous in terms of the life of the transplanted fat. So the smoking is absolutely not allowed, and we really don't even operate on smokers at the Image Cosmetic Center. The sutures come out in about 1 week, and there's only usually one small incision at the bottom of the buttocks, and then usually 1 or 2 or 3 small incisions around the front, sides, back of the abdomen, or wherever those are placed, and those tend to heal with minimal visibility, and within 3 months usually I can't even see them. But however, the same thing with the healing of the liposuction, the patient has to be prepared for not just a couple-week process. It takes up to 3 months for all the swelling to go away. So while you see an immediate result with every one of these, from where the fat's taken and where the fat's placed, the process of healing takes weeks and weeks and weeks to go on. For swelling to go down, there's a hardness that you feel deep down from where the fat was taken, and that improves dramatically over time. And when that is totally soft, that's usually the point of completely healed, and that usually does take 3 to 4 months. So it's really difficult to say what your final result will look like until you allow that healing process, and we have to ask everybody you have to prepare yourself to be patient for that period of time. But universally, here the liposuction and the fat transfer has been very positive procedure for all the patients. Just like in any situation, you're always going to have a couple of people every year that's the biggest complaint is frankly that they say that they should have, or felt like they could have gotten a bigger enhancement or enlargement. And like I tell everybody, the only enhancement we can give is from what tissue, what fat areas you allow us to take from, and what you have available. And then you have to remember that we split it in half, so you already lost half. Quite a bit of that is serum, 20–25% itself on each side, so you've lost a significant amount there. And then what you have left, we strain out, wash with antibiotics, and put in the butt. So it's usually not quite as much. Everybody says, I have so much fat, I should have a really big improvement, but that's not usually the case. In fact, we work hard to get it as much. And we like to get about roughly 300 to 400 cc's per side if we can. That's like the size of a moderate or medium-sized breast implant. So it wouldn't be quite this big, which is this is a 425 slightly underfilled, but you're going to get, I mean, not everybody's going to get this much fat increase, but we tell everybody you can expect at least about 1 inch. That's what we've done for. And if we can't get that much, if you don't have that much fat on you, then we're not going to advise you to do the surgery. There's a picture I show a lot of people, and I think it's a good illustration of trying to be reasonable, even, but not over predict. And I'll show you. There was a young girl, absolutely sweet girl that came in, but just had virtually no real buttocks at all, and she didn't have much fat. She was a skinny girl with a runner. So we picked a number of areas. I told her it's going to be a tough one, but we'll try. So we took fat from 3 or 4 areas on her abdomen and her thighs, and we're able to actually give her enough increase to where this was 3 or 4 months later, in a dress or with no clothes. She now had a little enlargement on the upper buttocks in particular, and actually took some off the bottom to shape it a little better. She actually had a little sagging there, but both the lifting from putting it in and the appearance of lifting from taking out the bottom, that's the true Brazilian butt lift. So even in the smallest person, sometimes it's possible to get an increase, and that makes all the difference in the world for somebody like that to start off with nothing. Here's another example. Here's a girl that very nice shape, and she was an entertainer. They encouraged her to get more volume because that was sort of the crowd she was working with, and so she had a little bit of fat on her back and her sides, not a lot, but good, but better. She wanted more volume. She wanted more projection there. Here's from the back, just giving her more volume from another side view. So there's a lot of different scenarios, but the Brazilian butt lift is basically the lifting comes from both placing the volume into the fat, deep fat of the upper part of the butt, and that virtually lifts up some of the buttocks tissue itself, and then of course taking the bottom off enhances the Brazilian butt lift. And so that's the situation, but we're happy to help anyone and certainly talk to you about it, and we appreciate your time.